Listening Part A. You hear a gastroenterologist talking to a patient called Joseph Alvarez. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. Alvarez. Your GP has sent us the letter about your problems, but why don't you tell me, in your own words, what's been happening?
Yes. Well, I've had blood in my urine and, this sharp kind of chest pain. I had an ECG for that, but it didn't show anything serious, but the pain was still there. So my doctor sent me for an ultrasound of my abdomen, but the result was alright. I think that's why he sent me to see you.
Yes. And you had a normal endoscopy 2 years ago. Well, how are you now?
My stomach always feels full up. It's just the same as before. It's been happening for at least 18 months now. If I'm lucky, on a good day I'll have no pain at all. But on a bad day it's pretty constant.
Does it ever wake you up at night?
I never sleep very well. I usually wake up because of poor breathing.
The pain you get during the day, is it when you're hungry or after eating?
Before I eat. After I eat, the pain usually goes away at first, but then it comes back again after about 30 minutes. It depends what I'm eating though. If it's something like oranges or lemons, they seem to be too acidic.
Ever had any problems swallowing food or liquid?
No, nothing like that. But it can feel like it's burning on the way down if I drink something hot.
I see. Anything else you can think of?
I often burp a lot after eating or drinking. That actually helps me feel better. I've never really vomited, even when I've been feeling my worst. But I can get this terrible taste in my mouth when I'm burping. It's like something very bitter. Sour almost.
Have you ever coughed up any blood or noticed any blood in your stools?
No, thank goodness.
Okay. Are you on any medication?
I used to take tablets for my ulcer. They were red and yellow. Losic, that's them. I'd take one for every 20 days. They seem to work quite well as I remember. That's it though. I don't really like taking a lot of pills.
It sounds like apart from this trouble you're quite well then.
Yes, touch wood. My wife and I eat a pretty healthy diet, I think. I never go out to pubs, but I have a glass of wine with dinner a few nights a week. I used to smoke 10 or 15 cigarettes a day, but I quit 2 months ago.
What about your family's medical history?
Well, I have 7 brothers and 2 sisters. They're all well and living in Spain. My mother died at 90 of a heart attack and my father at 77 of a stroke. Like I said, I've never really had any problems myself apart from this pain. I suppose I'm worried in case it's cancer.
Well, all of your tests have been fine, and your GP did a heart rate test and that was all right too. I'd like to examine you and send you for some blood tests.
Part A. You hear a specialist physician talking to a patient called Julie Dooley. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Your GP says you've been to see him about a lump in your breast. So, when did you first notice this lump?
10 days ago. I was doing my routine check when I was just so shocked to find it. It's in my left breast. I'm really worried because my mum died 6 months ago from breast cancer and I've been scared of getting it ever since.
How old was your mum?
65.
Do you know if anyone else in your family has had it?
I don't believe anyone else has. I don't remember...
mum?
65.
Do you know if anyone else in your family has had it?
I don't believe anyone else has. I don't remember either of my parents talking about it affecting their own mums.
Are you married?
Yes, but we separated 9 months ago. He went off with another woman and I'm on my own looking after my 2 children. I've got a girl who's 14 and a 12-year-old boy as well.
Have you ever been sick with anything serious before?
No, my health's always been very good.
I take it you're not on any medication then?
That's right, nothing. But there is something else that's been playing on my mind since I noticed the lump. I started remembering this pain I've been getting just here, in my chest. I never really thought anything of it before because it was kind of, I don't know, just very dull, like I'd pulled something, a muscle of some sort. So I really wasn't very worried about it. I just thought it would go away in time. But now, I don't know. Do you think it could be a sign of something?
That's difficult for me to say until I examine you and we run some tests. Is there anything else you can tell me?
About the pain? Well, it seems to go to my back. I usually only notice it when I'm sitting in a chair. Not a chair at the kitchen table. More like when I'm sitting in the lounge. You know, something with a high back on it. It did wake me from sleep once. It only lasted for about 15 to 20 minutes, but it was probably the worst I'd felt it. There hasn't been anything else really. Like I said before, I'm usually pretty healthy.
You haven't had any nausea or vomiting with it? No shortness of breath?
Nothing else except for what I mentioned. Oh, I do hope everything's all right.
Of course. Do you mind if I examine you now so I have an idea what we're dealing with?
No, that's fine.
Okay, there it is. Does that hurt?
No.
Right, it's quite solid, roughly 2 or 3 centimetres in length, I'd suggest. We'll need to run some tests to confirm exactly what it is. We can do those today, now actually, and then wait a few days for the results to come in. I'll need you to make a follow-up appointment on your way out today.
Okay, that sounds fine. I know I'm probably getting ahead of myself here, but if it is cancer, I really don't want to lose the breast. I'd hate to have a mastectomy. I dread that probably more than anything else. I really don't care what else happens, so long as I don't lose the breast. My mother had chemotherapy after she was diagnosed with cancer, and even though she lost all her hair, at least it grew back. I'd still be willing to try it.
Okay, well, you are jumping in a bit early here, but there may be options. First, let's run the test and wait for the results.